Doctors, what's a mystery about the human body that science still hasn't fully explained? Autoimmune anything. I used to think it was pretty straightforward, then I was diagnosed with a disorder. Everything is so hit and miss and open to interpretation, even lab results. I went from seropositive to seronegative at one point, like how? How do antibodies, rheumatoid factor, and ANA just appear or fluctuate? Depends on the rheumatologist you ask. Symptoms all overlap for so many similar things, and the treatments all work differently for different people until sometimes they randomly don't or do for a while then quit. Maybe you have lupus, maybe you have arthritis. Can't be sure, so take this malaria medicine about it and let me know if you get mouth sores, your liver swells up, or it does nothing for no reason. Could be the meds, could be a flare. Either way, it's going to affect parts of your body you never knew interacted. How is your relationship with gluten and dairy? Because it's about to get weird. Which came first, the depression or the inflammation? No idea, but here's another 4 pills about it. You're hypermobile. Ever heard of Ehlers-Danlos or POTS? Similar but different, but who knows? Why did you come in again? Fatigue. Story 2. Most of it isn't fully explained. Most of it is partially explained. A lot of engineering type people come into the hospital expecting the body to be explained. If there's a problem, you simply need to find the bug and fix it. Let me see the data. I can do it myself. And then they get wildly disappointed when symptoms and lab values and imaging doesn't correlate one-to-one, that medications have side effects that sometimes are worse than the problem they are meant to solve. And the replacement of one organ doesn't fix the rest of the organs that are failing, even if the damage was all related to the first organ. The idea that humans and their body parts have a lifespan is both innately understood and yet impossible for many people to comprehend. Anyway, there's more that we don't know than what we do know about how it all works. And that's why science funding and high-quality research are important to fund. Story 3. How we lose accommodation, our ability to read small print. We have a lot of theories but no concrete explanation as to why. The lens continues to grow throughout our life, but it becomes more biconvex, which should add plus power to the eye, but it doesn't. The ciliary muscle remains functional well into the 90th decade. The lens zonules remain attached and functional throughout life. We think it's a change of all of the above, but no smoking gun. This is why you can ask 10 different eye doctors why we lose our ability to read small print, and each will have a different reason why. Story 4. ALS. It's a horrible disease with no cure, no real treatment, no known cause, and a 100% death rate. Diagnosis is often only through a lengthy process of elimination. Typical life expectancy after diagnosis is 2 to 5 years. It causes slow, progressive degeneration and loss of muscle function, leading to paralysis. Probably something autoimmune related, which is its own can of worms. It has at least 3 common names for the same thing: amyotrophic lateral sclerosis, ALS, Lou Gehrig's disease, motor neuron disease, MND. Story 5. The microbiota, dysfunctions in which likely explain at least a few functional disorders that we don't understand, for example, IBS. People with IBS have symptoms but otherwise will have completely normal gastrointestinal investigations, i.e., there is no structural problem that can be conventionally identified. Increasingly, it's thought that IBS may be a disease of disordered microbiota, which in itself isn't well understood. The microbiota, even more mysteriously, seems to have some connection to the brain and the mind itself, which may be why IBS is often comorbid with psychiatric problems like anxiety and depression. Story 6. So many, too many. The common denominator for a lot of the deepest mysteries seems to be the hard problem of consciousness, what fundamentally allows for first-person subjective experience, qualia. Our current scientific models are rooted in physicalism, materialism, and they do a fantastic job explaining brain function and behavior, but we still cannot reconcile the fact of subjective experience with a purely physicalist third-person explanation. This same gap pops up in other areas like the placebo effect. We can map out some of the mechanisms like the expectation-driven release of endogenous opioids or dopamine, but the sheer power of belief and context to trigger profound, quantifiable psychological healing remains a staggering mystery. It highlights how little we understand the fundamental connection between mind and body. Story 7. Epilepsy, seizures. Most people don't realize this, but in around 60 to 70% of epilepsy cases, doctors can't find a clear cause. It's not that the cause doesn't exist, it's just that our current tests can't detect it yet. Epilepsy can come from tons of different things: genetics, brain injury, infections. But for most patients, it ends up being labeled as unknown cause or idiopathic, or in my case, stress. Science still has a lot to figure out about what's going on under the surface. Story 8. I've been in trauma therapy for several years, and some things my therapist and I have chatted about, we don't understand a lot about mental illness. Almost all of it is guesswork, basically throwing crap at a wall and hoping some of it sticks. I have done a ton of EMDR work, and I once asked how it works. He replied, "We don't know. We just see the results and know that it helps." Which is crazy. There is so much that we are unsure of. Do I have borderline because of the cruelty I received as a child, or do I have it because I was born with it, or both? Is it even a real illness? Some scientists claim it doesn't actually exist. Some say adults with BPD are just autistic children who never got proper treatment as a child. No one can even really say for certain how to cure it. Some dude made people stare at a bouncing light and had them relive their most traumatic experiences, and then the results came back very favorable and he has no idea why. We don't understand schizophrenia at all either, and there are new studies coming out about more types of schizophrenia than we ever thought of before. We've scanned people's brains and physically seen mental illness, and we don't fully grasp that either. People diagnosed with BPD have overactive amygdala and an underactive prefrontal cortex, yet we can't pinpoint a way to process all of that. Story 9. Also not a doctor, but I am an LMT, so this is in my wheelhouse. What are knots and how do they function? I graduated in 2006 and my teachers all said, we don't know. 19 years later and we've done a few studies, but we still don't know. Knot sensations can cross the central nervous meridian, which shouldn't be able to happen. They are impervious to Botox injections and lithotripsy. The only thing we know that works is static pressure sustained for 20 to 30 seconds. Story 10. Endometriosis I just decided to learn about, so y'all are getting info. No guarantees as to its veracity. LOL. Tissue grows in random organs and we don't really know why or how to stop it, except less estrogen or take the uterus out. It's like cancer, no biomarkers, some weird genetic abnormalities, only 3 or 4 trials in the US that I know about, even though it affects like 10% of women. It's probably an immune tolerance by hormone genetics problem. The functional med approach is bioidentical progesterone and supporting liver detox with DIM and the like, and aspirin as an NSAID, and that probably helps. The Western approach is birth control or yank that uterus out if it's really bad and you're lucky enough to find a doctor that would. My guess is in 20 years we'll have some very specific biomarker-based pharma medicine, maybe even pulled from, for example, cancer research, maybe an immunomodulator of some sort. Hopefully it comes sooner because the condition seems like hell. Bits of tissue throughout your abdomen that flow like a uterus except outside? OMG, the horror. Story 11. Functional neurologic disorders, formerly psychosomatic and some other descriptors that were unkind and stigmatizing. Things that look like seizures, paralysis, involuntary movements, etc. On a deeper level, we don't quite understand why these happen. Neurologists are the most likely to be pretty empathetic about these. Not that we don't have bad apples too, and the most likely to overturn an improperly labeled FND, partly because we see a lot of it. It is absolutely real and absolutely common. Go to the furthest lengths to prove when it's real and recognize the stigma that still exists among other doctors and NPs and the world at large. These diseases are not deliberate behavior and they cause just as much suffering as other diseases. It's just that it's more of a software than a hardware issue. Unfortunately, many people with this feel disregarded, and many rightly so, lots of schmucks in healthcare. When they get this diagnosis and will go to questionable doctors and NPs and chiros and grifters to get insane treatments that give them real health issues from side effects. Thankfully, younger doctors are better at diagnosing these issues and approaching them empathetically. There are treatments. Story 12. The problem of mind, body, and consciousness. I actually just took a course on this and it's really interesting. What defines a human? Is it a person's physical body or is it an accumulation of their experiences? Although we know our brains connect to neurons that affect how we think or conceive of memories, we don't know how. And maybe through advances in prominent sciences we may learn, but it still wouldn't explain consciousness as a whole. If you are interested, I would look into it. There's quite a few papers on the philosophy of mind. I would suggest Kim and Chalmers, but I might be a little biased. Haha. Story 13. Not a doctor, just a nurse, but in my personal life, I have had the care of 12 babies for 8 or more hours a day, children and grandchildren. I think it's usually one of 2 causes, reaction to feedings or overstimulation. Some babies with colic do better if you put them in their cribs. Some prefer that to being rocked, but if you're the type, like I am, that thinks all crying babies should be held, it might take a while to figure that out. One time I was 15 minutes into the usual 4-hour colic session when I had to urgently use the bathroom. I put the baby in the crib and he immediately stopped crying. Next night, I tried that again when he started the usual screaming and he stopped again. From then on, if I knew the baby was fed and dry, I would try that first. You pretty much know right away if it's not going to work. And it won't work on the majority of babies. So those that don't want to self-soothe, I am convinced that it usually has something to do with a reaction or intolerance of whatever they're being fed. I breastfed my babies and through trial and error figured out that with the oldest one, I could not eat onions or he would have colic. With the second one, it was citrus, and with the third one, it was milk products. Interestingly, that third one is now lactose intolerant as an adult. In the case of formula-fed babies, it's a little easier to cycle through some acceptable choices until you find one that works. Although, to be honest, sometimes by the time you've tried all of those, they've reached that magic 3-month mark and they're over it anyway. Story 14. How the immune system works. Nobody has any idea why autoimmune conditions happen. We know that viral infections or high levels of stress can trigger them, but we don't know why. We don't even fully understand what some of our white blood cells do. Those who watch cells at work are probably familiar with some of them. The neutrophils, one of the most common ones, the eosinophils, which target parasites, and the basophils. Nobody knows what the hell the basophils do. There's only 1% of them in our body, and we know that they have something to do with the inflammatory response, but other than that, no clue. There also seems to be a connection between eosinophils, the parasite terminators, and allergies, as eosinophils are involved in the allergic response. This was not shown in cells at work. Why? Well, we think it could be because the lack of parasites in our body is causing our immune system to freak out and start seeing random things as a threat, like pollen, but that's just our best guess. Story 15. Not a doctor yet, but currently in my 3rd year of medical school, and the answer is all kinds of things. There is so much we still don't fully understand yet. I'm currently working on research involving a disease called heterotopic ossification. It's a phenomenon sometimes seen following trauma or surgery that involves formation of bone outside of the skeleton and the soft tissues, and in severe cases, the entire area surrounding a joint can essentially turn into bone. We have identified several risk factors, and we're pretty confident that it's linked to inflammation, but we still don't know why it happens. Story 16. According to every doctor I talk to and several months of research, there's a condition where the top middle of your foot will feel like it's being stabbed randomly with a needle, and then the exact sensation of a steak knife. After the attack, there's absolutely no after effect. It's like it never happened. All you can do is wait for the next attack. I suffered for a month and a half straight of this. Doctors had no idea what it was. Everything about it was random and there's no way to cause an attack. Out of desperation, they gave me a cortisone shot, missed, and hit a vessel. After a week or so, it stopped. There's this random website dedicated to the few people that suffer from this. No one has been diagnosed or found out what it is. I'm one of the few that escaped hell. I've been told there was nothing in the medical journal, so I named it Voodoo Dorsal Foot Syndrome, or VDFS. If you suffer from this, maybe make them give you a cortisone shot right at the spot it stabs, not in the ankle area as you would for this other thing. I forget what it's called. That's for when you bend your foot a certain way. Story 17. What exactly a gene is. Since the discovery of the DNA structure, we've generally been operating under the assumption that one gene, one stretch of DNA, encodes one protein. That protein will have a job in your body. Maybe it synthesizes the pigment in your eye, maybe it digests a specific type of carbohydrate, etc. The human genome has about 25,000–30,000 genes as we classically understand them, yet an individual cell can have 100,000 different proteins, meaning our understanding of how genetic information translates into biological function is lacking in several key regards. To add to this, we're now aware of non-coding genetic elements, essentially regions of DNA that don't translate into proteins, but are still crucial to normal cellular functioning. In short, whilst we can look at individual genes in a vacuum and have a good theory or mechanism for how they work, the question of how you go from 46 chromosomes to a full human being is still very much open. Another genetic mystery is how redundant genetic circuits persist between generations. In theory, if you have two genes that do the same thing, random mutations should lead to one of those genes being lost, and yet over and over again we find backup circuits, redundant circuits, and failsafes. Story 18. Not a doctor, but digestion and gut microbiome health. Few doctors understand how to actually fix problems, especially those relating to IBS. They just say to avoid certain foods that make things worse. I used to have an iron gut up until about 5 years ago, rarely ever got sick. Then I was force-fed nothing but cheap white bread and peanut butter for every meal for a year after I escaped that kidnapping. I couldn't digest food the same way. Everything slowed down. It took forever to digest most foods, and I am always sick and tired now. I'm mad. Everyone involved in that kidnapping should be punished. I might have 3, 5 enjoyable days in a whole year. I would have thought after some years that I would regain my old health back if I ate properly. Seems it doesn't matter what I do. Nobody has any answers as to how to restore gut health permanently. Everything is a band-aid at this point. Literally, gut-wrenching to see my life basically end in an instant moment because of a gang's criminality. Story 19. Trichotillomania or other BFRBs, including skin picking and nail biting. It's a mental health disorder that causes physical problems. There is a ton of cluelessness in the medical community as to why people pull their hair and bite their nails to excess. A lot of it is chalked up to stress, but it can also happen because of boredom. But stress reduction doesn't necessarily reduce these behaviors. Sometimes they go into remission on their own for no particular reason. There is a supplement called NAC that helps reduce these behaviors, and it can also help with symptoms of OCD. But that seems to be the only quote-unquote medication that you can ingest that helps with BFRBs. Anti-anxiety and antidepressants often make it worse. Story 20. Doctor here. Off the top of my head, there's a few deceptively big ones. We still aren't exactly sure how anesthesia works, we just know it causes certain effects and they are useful, so we use it. Psychiatry is still shockingly infantile in our understanding of human disorders. It's constantly in a state of flux, we don't understand a lot about the meds we currently use, and the diagnostic criteria for disorders still changes as we realize, quote, hey, maybe all these behaviors aren't the same source disorder. It's incredibly hard to diagnose when the criteria is largely based on self-report and subjective observations. To a lesser degree than number 2, neurology is still learning a lot. It's further because you can observe more objective findings in neuro than psych, but we still struggle a lot with how brains function. Immunology, don't even ask me because no one really knows. Yawns, still guessing on why that happens too. There's some theories, but that's the best we got. Story 21. There are organelles called vaults in human cells and in most other eukaryotic species. They are made of 78 copies of a protein called the major vault protein, totaling about 3 times the size of a ribosome and larger than most viruses. Their function is not totally understood, but it's probably something to do with the nucleus, though analogs of the genes for vaults even appear in bacteria. As they are found in such a wide variety of species, life on Earth must have started making vaults early in its history. The similarity of the genes encoding vault proteins across diverse species would presumably indicate the importance of vaults for viable life, but experiments haven't shown a great deal of harm done to lab animals that had their vault genes knocked out. Even stranger, several of the species used in laboratories as model organisms naturally lack vaults. The use of these organisms long predates the history of vaults in 1986, with some going back over a century. Story 22. Had a pathologist tell me that the interesting part of his job wasn't finding out how someone passed away, it was seeing everything that can be wrong with someone, so many life-threatening or life-altering horrible things that a person can have going on and still be alive. Good friend passed away from pneumonia. He was too busy at work, couldn't afford to take time off. He kept using OTC meds for the symptoms. He passed away unattended, so the coroner had to get involved. They did an autopsy. His body had cancer in 3 different places. He never stopped. Dude was old-time rough. Story 23. One of the frustrating but not so secret things in medicine is that racial differences exist and they can't be discussed in today's climate. There are differences in medicine efficacy, growth, disease susceptibility, or immunity, just about everything. It's preventing personalized treatments. AI can now pretty accurately guess someone's race and gender from a single view chest x-ray, so things may change. People always think of this as a negative, but in reality it should be approached like family history being super relevant for cancer or heart disease surveillance. Story 24. Not a doctor, but I always found it kind of wild how unsophisticated a lot of surgery is. Like, it is the year 2025 and our best solution for lots of problems is still just cutting something, like your hand or wrist hurts, let's just cut that ligament. Oh, you've got stomach pains, let's just cut out the gallbladder. It is crazy that we haven't figured out less barbaric solutions to a lot of these problems. Since not a doctor wasn't clear enough, I will clarify I am not a doctor, I am also not a med student, I am also not writing a dissertation on gallbladder issues or carpal tunnel syndrome. My personal experience with these diseases was pains in my hand and wrist and pain that felt like it was coming from my stomach. After making these complaints, I had surgery. That was my experience. If you expect a random Reddit post from a guy who started the post by saying not a doctor to read like a medical textbook, you might just need to adjust your expectations. Story 25. I'm not a doctor, but when I found out I was having identical twins, I started looking into the biological process that leads to identical twins, and it turns out nobody knows. There's a lot of info on the type of identical twins you'll get depending on when the zygote split, like whether a placenta is shared, if the sac is shared, or if they're conjoined, but like, why? There's also significant disagreement in the medical community on whether or not there is a hereditary factor. Feel free to correct me if my info is out of date though, because I looked into this about 5 years ago. And if you're learning a thing or two from this video so far, don't forget to hit that subscribe and like button for more videos just like this. Story 26. We still don't know what actually causes ADHD, which is why it is not readily accepted as being a real disorder by much of the population, and people think it only affects attention. However, without trying to make this into a lecture and keeping it short, there's a very active part of the brain that does a lot of things. We don't know what those things specifically are, but there are a lot of indicators it does something big. The claustrum, the theory goes, it's the part of the brain responsible for actual consciousness, but back to the ADHD part. About 2 to 5% of people have ADHD, and if you're on social media, it sometimes feels like even more. What many people don't realize is that ADHD is linked to significantly higher rates of severe mental health challenges throughout life. In fact, individuals with ADHD are statistically more vulnerable to serious emotional crises and dangerous situations that can impact long-term health and safety far more than the general population. It's a condition that requires awareness, support, and proper care, not just memes and stereotypes, but anyway, what we do know, the claustrum lights up with greater activity with people who have ADHD. We know when the claustrum is inhibited in rats, they kind of just do whatever. If one day we understand the claustrum better and it turns out that it is responsible for ADHD, that would mean the general public could finally come to understand, especially the parents of ADHD kids, who are significantly more likely to mistreat their ADHD children, that they're actually mistreating their kids because of a health issue more closely related to epilepsy than just lack of discipline or behavioral problems. That shift in thinking would save lives. I hope the purpose of the claustrum is clearly identified and understood one day. It also might mean people with ADHD may experience human consciousness very differently too, and that's where it gets really interesting. Story 27. I'm a surgeon scientist still in the decades of training, but toward the end. I'm planning to subspecialize in trauma surgery and critical care, so that's where most of my interest is focused. Something I'm currently studying is understanding who lives and who perishes after major trauma. In other words, why are some patients resilient and bounce back after trauma, while others never improve or pass away, even when it's the same injury pattern, severity of injury, age, comorbidities, etc. In the same line of thought, there is a lot of ICU medicine we don't know. Once you're in the ICU, like with trauma or with sepsis, we mostly use supportive care and are behind the ball in treatments as we don't understand the pathologies well enough to take active/preventive measures. So, like trauma patients in the ICU are at substantially higher risk of infection, usually ventilator-associated pneumonia, but we don't know why, who is going to get it, and we don't prophylactically treat either, but wait for it to happen. Similarly, for trauma, we don't know even the most basic pathways of how the body responds to trauma, why severe trauma leads to a massive systemic response, while less severe, how is that even defined, leads to a more localized response to then even figure out which pathways can be targeted to help with recovery. Story 28. I tell my residents that only about 40% of what we do is evidence-based. Much of what we do is based on flimsy evidence or grossly inadequate follow-up. For instance, the longest semaglutide trials are around 2 years. They make it sound longer by reporting the duration in weeks, 104 for Sustain 6 and Step 5. What's the plan for following up to see if these medicines are safe for 5, 10, or more years? There is an encouraging trend toward reviewing established treatments, with a bunch being subject to medical reversals. See the book of the same name. Think of 3-vessel coronary disease, estrogens, and menopause as the prime examples. This is a roundabout way of saying we mostly don't even know what we think we know about the body. If you want to lose sleep about how fragile we are, consider the basilar artery. This single point of failure to your brainstem is only about 3 millimeters wide, with flows about 150 milliliters a minute. 3 millimeters is a bit over 1/10 of an inch. Also, we have no idea why we sometimes shiver when finishing. Story 29. Not a doctor, but a patient that has found a couple of things with blatantly missing answers. Allergy tests do not tell you what you are allergic to. A prick test can tell you what your skin is allergic to. And a circulatory fluid test can tell you what your circulatory fluid is allergic to, but there is no test that can tell you what your stomach or your GI tract is allergic to. You can do an elimination diet for an extended period to find some answers, but even then it's not 100% conclusive if a particular food or a group of foods causes inflammation or non-life-threatening allergic reactions. I have a condition called costochondritis, where the rib joints lock up. When they come free, it feels like a heart attack, which is also fun with GERD causing similar pains. No one knows why people have it or how they develop it. Maybe it's overexertion, maybe it's underexertion, maybe it's pregnancy or weight or walking too hard. Or maybe you're just unlucky, despite medical reports showing the vast majority have it for 1 year or more. Most doctors don't have any knowledge of it, shrug it off as nothing, and treatment is basically take a couple of Advil and you'll be fine. I'm going on 5 years with it. I am certainly not fine. Every doctor looks at me like I'm crazy. Hell, I spent this weekend in bed because I was having a flare-up and in so much pain. But my heart and lungs and GI check out, so I'm out of luck, I guess. Story 30. My mom is an RN and my husband has been to a lot of specialists for different medical issues. I promise you that most doctors have no clue what's going on and they're looking things up when they're not in the room. I will say the only time I was sure, without a doubt, that a provider knew exactly what was happening was when my husband was evaluated by a neurosurgeon back in 2023. We knew that he had stenosis of the cervical spine, meaning the vertebral column in his neck was narrowing and would eventually squeeze his spinal cord to the point of paralysis. Surgery for that is one of those, once we absolutely need to, we will, but not until then, so look out for these symptoms, especially when your healthcare coverage is through the VA. One night in January of 2023, my husband started getting drop foot when one leg won't pick up properly, and he couldn't lift his right arm up much past his hip. His fingers were numb and he fell a few times, but luckily he landed on the couch both times. I told him I'm bringing him to the hospital, and this was around 4 a.m. I was still dressed for a night out, and the nurse in the ER assumed we were substance seekers and basically told us we were wasting our time. I was pretty irritated with her attitude, and I said, "Did you miss the part of his explanation where a neurologist told him if he experiences his current symptoms, he needs to get to an emergency room? We don't want your substances, we want him to not be paralyzed for the rest of his life." A very long story short, he was admitted and he had been seen by lots of doctors who all had ideas about what was going on. I was deflated, and so was he, and over 24 hours after being admitted, the neurosurgeon walks in. He has this air about him, not cocky or arrogant, but just like he's on a mission, like he knew exactly what he would see. He does a physical examination, very specific neurological checks, and I somehow just knew that he had answers for us. He told us that my husband was experiencing the effects of his spinal stenosis and that he needed emergency surgery on his spine. He talked us through what a posterior cervical laminectomy would entail and that it was his opinion that it needed to be done now. Some of the damage was already done, and the longer we waited, the more permanent damage would come. Every doctor that had seen my husband, besides the people in neurology, were just throwing spaghetti at the wall to see if it would stick. He had been drilled about being an intravenous substance user because he absolutely had an infection in his lumbar spine. He didn't. And was put on IV antibiotics before being examined by the neurosurgeon. One doc told him the symptoms in his upper body and the ones in his lower body could not be related, and he demanded to know which one set in first. No matter how many times we said they happened at the same time, he was adamant that that could not be the case. A lot of providers are egotistical and get stuck on what they think the problem is without considering they might be wrong. I thank our lucky stars that a neurologist examined him and requested a consultation from the neurosurgeon. That saved my husband's life, and he regained 95% of his lost mobility because we were able to get him into surgery within 48 hours of his symptoms. I also have pictures of my husband's spine because he was able to convince the doctor to bring my husband's phone into surgery and have someone take pictures. It's absolutely gross and amazing. Story 31. Not a doctor, but well-researched on gadolinium deposition disease. I have it. Despite being injected literally 500 million times, no one knows why some people suffer from severe heavy metal poisoning and disability after receiving MRI contrast. There is alarmingly little research on these medicines and almost no long-term health effect studies. Also, everyone who gets contrast has some amount of gadolinium deposited in their body and organs, and no one knows if there are any long-term consequences to this. Story 32. One topic that remains intriguingly underexplored is what I like to call neuroquantum resonance. While not recognized in any mainstream literature, emerging anecdotal evidence from isolated clinical observations suggests that microtubules within our neurons might behave like tiny quantum processors. In theory, these structures could facilitate instantaneous shifts in neural firing patterns via quantum-level vibrations, effectively tuning our brain circuits in real time. For instance, there are reports of patients experiencing fleeting episodes of hyperclarity or unusual pain suppression during periods of extreme stress or under the influence of certain environmental factors. The hypothesis behind NQR is that these quantum fluctuations momentarily realign synaptic connections, allowing the brain to bypass typical processing routes. This could potentially explain phenomena such as sudden flashes of insight or, conversely, brief moments of sensory dulling. Although these ideas remain speculative and any rigorous study is hampered by the challenges of isolating quantum effects in biological tissue, the concept of neuroquantum resonance offers an exciting frontier. If proven, it might not only revolutionize our understanding of consciousness, but also pave the way for entirely new therapeutic strategies targeting these quantum pathways. Story 33. Not a doctor, but I've spent a lot of time in doctors' offices. There's a lot of health issues with me. So, I have an illness called idiopathic intracranial hypertension. The idiopathic means they don't know why it happens. So, I got it right after I got the Mirena IUD. It turned out a lot of people get it right after they get the Mirena IUD, enough for a class action lawsuit to be filed. It got tossed immediately. So, Mirena has listed in the side effects it could cause a stroke. Sure, but affect cerebrospinal fluid? Absolutely not a side effect. But here's my thing. If I go to my gyno right after I get birth control and say, hey, I've had a nonstop headache and I'm concerned, they shouldn't wave it off and say it's normal. They should remove it and send you to a neuro to check for a stroke or CSF issue because it's a possible side effect, but they don't. And neuros deny birth control could be an IIH factor because it's not listed in the official side effects. But also, so I got my thyroid removed years and years ago. I'd been on a stable dosage of levothyroxine for like 6 years. I get the Mirena, the CSF vein, and my brain collapses, and all of a sudden my TSH levels go wild. It's like 7. It had been 1, so I am no longer absorbing my levothyroxine correctly. My neuro tells me to keep in the Mirena. My endo tells me the Mirena and the IIH can affect the levothyroxine absorption, and I'm just suffering. Over the course of the year, we keep adjusting the levothyroxine, and my TSH just is not playing ball. It's just ping-ponging wildly. 1 year after all this starts, I just take the Mirena out against gyno and neuros' recommendations. The pain of my never-ending headache decreases significantly. My TSH levels finally go back to normal. All my doctors just shrug. Oh, what a coincidence. It wasn't the Mirena, though. It can't do that. Also, when my brain collapsed, I suddenly became intolerant to a lot of foods, but according to the allergist, that doesn't happen. You don't suddenly become allergic to basically everything. She kicked me out. I basically eat the MCAS plus oral allergy syndrome diet now, but honestly, help would be good. Brain damage couldn't cause massive food intolerances. What the heck? I also spent 2 years just losing consciousness over and over again every day from the sheer agony of it all. After I finally got neurosurgery, I couldn't fall asleep naturally anymore. No pain, no sleep. I went to a sleep specialist and he was like, pain keeps you awake. It doesn't put you to sleep. You aren't special. I don't think they've researched people stuck in a never-ending migraine for years. Working with doctors is hell. Story 34. What's interesting is that at a fundamental level, there are many unanswered questions. This is true for some of the most common illnesses we observe and manage. We tend to know a lot of the associated risks and exposures. We tend to know some, but not all of the genetics. We know how to treat a lot of them. We just don't know what causes type 1 diabetes. We don't know what causes asthma. Lots of associated conditions and exposures, but the exact cause is elusive. We don't know exactly what causes some premature babies to develop very severe BPD, and some to not. We have a good idea of some of the phenomena, but don't know the exact step-by-step cause. We're also getting much better at taking care of these babies. Laryngo chemoreceptor hypersensitivity. I see maybe 3 or 4 of these babies. They often also have reflux. Their vocal cords slam shut and the baby turns blue, scares the families, rarely dangerous. Babies grow out of it, thought to be due to sensitive nerves in the voice box. Much of the brain, for that matter, how the brain knows to breathe and control of respiration, we're quite close and know much of it. There are a few elusive, unanswered questions. Eczema remains somewhat of a mystery in the same way asthma does. A few molecules and genes are identified. The exact pathophysiology is a bit more complex. Story 35. I'm a PA, physician assistant, retired after 40 plus years of clinical practice and academic work. I can tell you that the more we learn, the more we realize there is left to learn. The placebo effect is real. We don't know exactly how, but it does work, and not just with pain relief. Many medicines we use routinely work great, but we don't know exactly how they work. The pharmacology is unclear. Although newer technology has given us greater insight into how the brain works, there are still a lot of unknowns in how our brains work. Every time I've wanted to learn more about a specific subject, and OB-GYN was never one of them, I end up with more questions than answers, and it's why I love medicine. Story 36. Another not a doctor, but response. I have a rare condition. I've gone to specialists, multiple different doctors. My body, every 7 to 10 years, attacks itself. What? Yeah, so every 7, 10 years, I get an allergic reaction that sets my body off. I get hives all over. Medication does not work to get rid of the hives. Every time it happens, I end up hospitalized for a week or 2 depending on how bad the episode is. When it happens, they try an allergy medication and it does not work. They tried giving me adrenaline and it works for a minute or 2 and then boom, the hives come back. I have to be in a hospital with an IV for a week or 2 every time this happens. I've had tests done to see what I'm allergic to and the answer is nothing. The last doctor I went to said on a subatomic level, something is happening and we don't know what it is. Story 37. I'm not a doctor. I am a facility manager of a medical clinic with 2 degrees in science and many certs. My answer? Bad cholesterol in athletic people. We simply don't get it. We even treat it when we know we shouldn't. An athletic person can have horrible cholesterol and live to 92. A slightly chubby person has the same out of whack cholesterol profile and they will perish at 62. And a more prevalent issue, we simply don't know how to impress upon patients the importance of following up on their health issues, especially ones with extremely mild immediate symptoms that take 10 years to cause severe health issues. So eventually, medical care providers stop trying because 99% of patients will ignore them anyway. Story 38. I'm not a doctor, but I can say we have virtually no idea of what the gut microbiome does or what makes up a healthy mix of bacteria. There are all sorts of pseudoscience tests out there now that will diagnose you with, quote, bacterial overgrowth or whatever. But the reality is our gut is a war zone and we just don't have enough knowledge to say which troops work together and which are actively hostile. The byproducts of these battles are chemicals put out by dying or victorious bacteria. Those chemicals affect everything in our bodies, including mental health. Some scientists even believe consciousness ultimately resides in the gut, not the brain, and that we are essentially a colony animal. The mechanism of action for most mental health medicine is not clear. Scientists used to think they directly boosted neurotransmitters or flooded synapses. What may be more accurate is that they terminate certain bacteria, and eliminating those bacteria results in a rebalance of brain chemicals. Weight loss medicines and surgery also seem to affect the makeup of the gut biome. It is this change in composition that supports weight loss. Some bacteria are simply better at processing foods in our gut. Some contribute to inflammation. Story 39. With all of the amazing, astounding technological and scientific advances in medicine, so many of which are truly miraculous, why is it that so far correcting vision is still done by placing plastic or metal objects on one's face or on the actual cornea? Why isn't there like a pill or a simple corrective surgery that doesn't cost $10,000? The thing is, laser surgery doesn't actually cost that kind of money, that many thousands. It's purely profit and franchise costs. The actual cost is relatively the time of the person doing the procedure, which takes less than an hour. And by the way, lenses don't need to cost hundreds even for progressive or difficult prescriptions. Lenses are all done by machine now. Again, those costs are purely profit and possibly franchise fees. No actual physical material costs. I get my lenses done for under $100 and they're a difficult progressive prescription. I get them online, while in a bricks and mortar shop, I get charged nearly $350 per lens. Just venting a bit, sorry, won't even go into the whole dental implant issue. Holy cow, that's another one. Story 40. I am still hoping someone invents a total replacement spine for those of us suffering from a bad spine. I mentioned this years ago to all the doctors I have met throughout my working career of delivering emergency medical equipment to hospitals everywhere. I told each of those doctors I would volunteer my body for science purposes to have a full spine replacement because at my age and health issues, even if it caused my passing, I would be in a better, less painful place. But if it worked, I would be able to live a full life again, doing the things I have given up because of the highest level of pain daily. So please, doctors, figure out a full spine replacement and then pick me. Story 41. I'm not a doctor, but a medical researcher here. One of the most fascinating unknowns is that we still don't fully understand how memories are physically stored in the brain. We know neurons form connections and synapses strengthen, but the actual mechanism of how a specific memory, like your first kiss or how to ride a bike, is encoded, stored, and then retrieved decades later remains surprisingly mysterious. Even more bizarre, we can actually edit memories during recall and reconsolidation, but we don't fully understand how this process works either. The brain casually stores petabytes of information in a space smaller than a cantaloupe, runs on less power than a light bulb, and we're still figuring out how it pulls off this incredible feat. And if any of these stories got to you too, here's more for you. YouTube thinks you're going to love this. I'll catch you in that video.